So very good evening to you all. Shri Kumarswami Mahavidyalaya Ausa, District Latur in Maharashtra State. It's organized World Record Series 2. Today there is 273rd day of the long series. And the resource person for today's session is on dais Honorable Dr. Juri, Borah, Madam. So first upon, I welcome to you, Madam, for the platform. I welcome the Chief Organizer of the series, Honorable Principal M. Ambedkar, sir. I welcome faculty members of my college and all dear participants. The topic for today's presentation is reproductive health. Now this topic is going to present, as I have mentioned, Honorable Dr. Juri Borah, ma'am. She is an assistant professor and also head of the Department of Anthropology. Now I present serving at Gurucharan College, Silchar in Assam. So with the brief introduction, now I request you, madam, please start your presentation on the topic reproductive health. You are most welcome.
Thank you, sir. Good evening and namaskar to all. Honorable Chief Organizer of National Level World Record Webinar Series, as well as Principal of Shri Kumarswami Mahavidyalaya, Maharashtra, distinguished personalities from various parts of the globe, as well as members of the World Record Series family. At the very outset, I would like to thank Dr. Ambedkar sir for giving me an opportunity to deliver a lecture in this prestigious webinar series. And it is indeed an honor and privilege for me to be a part of this program. As per my credential, I will try to present a topic that is reproductive health. Sir, kindly. Yes, it. Yes. Okay. Is it okay, sir? Anything else I have to show? Okay. That one, this one. Okay, okay, sir. Okay. The main concept, that is common one concept, health. We all are familiar with the word health, and health means complete physical, mental, and social well-being. And reproductive health, it is the most crucial facet of general health. And reproductive health, it refers to the condition of male and female reproductive systems during all life stages. As I am a teacher of social science background, so I am going to discuss this topic from biocultural perspective. And here I'll discuss about various issues related with reproductive health. And more emphasis will be given on female reproductive health. Both male and female are associated with the concept of reproductive health, but female are considered as the most vulnerable section, as well as they are the main health care provider for the entire family. And that's why I am going to present mostly about female reproductive health issues. The reproductive role of a woman, it starts just after experiencing menstruation, and after that a woman experience some vital processes like conception, childbirth, breastfeeding, child rearing, and it is completed after experiencing menopause. Therefore, it's an every stride in women's life has to get notable attention among the people, since if any stride of life it brings any problem, and that creates hazardous condition to the future life of a woman. First of all, it is about menstruation. All of us, we are familiar with the term menstruation, and when it is normal menstruation, then no problem. One girl can live a normal life without facing any problem. But it is observed that female counterpart, they suffer various kinds of menstrual dysfunction. And for this, no doubt, biology is also responsible, but our awareness level is also responsible for it. And when it is menstrual dysfunction, it includes like menstrual pain, then irregular menstruation, hypermenorrhea, hypomenorrhea. So different problems women suffers. And first of all, the woman has to be aware about the maintenance of hygienic menstrual practice. Nowadays, disposable napkins, these are used and it is found everywhere. Many women, they use, but still quite a high proportion of female counterpart, they do not use any disposable napkins during menstruation. This is the reason, maybe lack of awareness as well as economic condition. And whatever it is, but it creates problem to the female counterpart. And it is observed that many females, they use some old linen cloth instead of disposable napkins, and that is self-prepared. That is prepared from old bedsheet or any kind of dress they used already, and that is again used as napkins during periods. So this is one issue. And again, frequency of changing napkin. One may use disposable napkin also, but frequency of changing napkin also related with reproductive system, because if same napkin is used for the entire day, that is also not good sign. And although very a quite section of the female counterpart, they are suffering from menstrual related issues, still they do not like to seek treatment, and they actually do not want to disclose about their problems with the family members also, and sometimes only with the friend circles also. And they do not want to go for doctor also. That's why for a longer period of time they suffer. And if one problem is suffered for a longer duration, that is difficult to handle easily. Early diagnosis is good. And here you see one picture that is drying clothes in one unhygienic place. So this is also one problem. They are actually not aware that they should not dry their clothes in this way as they are using. So this is actually related with poor reproductive health. Reproductive tract infections, shortly it is RTI, and RTI is one of the most treacherous rudiments for fetching poor reproductive health. RTI is a generic term. It covers three types of infection. One is endogenous infection, next ectrogenic infection, and then sexually transmitted infections. First of all, I am going to discuss about endogenous infection. Endogenous infection, it results from overgrowth of an organism normally present in the vagina. And the example may include bacterial vaginosis, then candidiasis, and which are the result of an infection by fungi and common genus is Candida. So you see, this is the picture of bacterial vaginosis. So this red part, it is infected area. Then this is the picture of candidiasis. The chest part is affected. Chest part, neck, everything is affected. Here, tongue. Then it is under the breast portion. It is affected. Next one is ectrogenic infection. It results from the improper medical procedure. Actually, when medical procedure is applied either during childbirth or during when it is tried to insert intrauterine contraceptive device, then induce abortion, and also to cure problem of medical menstrual irregularities. In that kind of condition, actually medical practitioners, they use some instruments, and these instruments sometimes may not be sterilized. So unsterilized instruments, it infects the reproductive organ. And also, suppose one problem is already in the lower reproductive tract, and during the insertion of IUD, that time the problem which is already there in the lower reproductive tract, that is pushed through the upper reproductive tract. And when the problem is in lower reproductive tract, that is relatively easier to cure than it is in the upper reproductive tract. So upper reproductive tract creates more problem to the life of one person. So some examples like infertility, hair loss, hemolytic anemia. So different problems one may suffer, but these are the common problems. Next, it is sexually transmitted infections. Shortly, it is STI. And STIs, it is occurred because of infection of virus, bacteria, or parasitic microorganisms that are transmitted through sexual activity with an infected partner. Many examples are there, and common example, that is gonorrhea in throat. This is the picture of gonorrhea. Then this is the gonorrhea problem in little baby. And again, in case of reproductive organ of male and female, that is gonorrhea problem is found. And in case of newborn babies, sometimes because of this gonorrhea problem, it makes permanently blind. And other problems are also found like brain damage, then problem in spinal cord. And in case of adults also, many problems are found with the gonorrhea. Then herpes, various types of herpes are found. So it is in the skin of female. Then it is genital herpes. It is occurred in male also, but female also. But it is the picture of male of reproductive organ. Then herpes, it is in the lip portion. This is. Then syphilis, the problem, it is observed in case of male reproductive organ. Then this is in the female reproductive organ. Then again, this is in male reproductive organ. So various types of syphilis. So it is in the breast. So it is in the body. Then it is in the heart. Then human papilloma virus. This one is the problem. It is toe and sole. It is mostly observed. Then chlamydia. It is male chlamydia. Then it is a common one, that is common skin and mucosal problem. It is HIV/AIDS. So out of various sexually transmitted infections, maximum problems are means it is preventable, as well as if one suffers, then one can, if one takes medical support, then it can be cured. But herpes, it is found that herpes is difficult to cure permanently because herpes, in case of herpes, then in many that in case of herpes, it is found in a nerve cell and in inactivated mode for a longer period of time. So medical practitioners find it difficult to solve the problem of herpes. And various issues are there related with RTI. One is reluctance to seek treatment. So when someone suffers, if they are educated, they seek treatment mostly. But in many cases, we have in our society, we have reluctance to share our problem. We suffer silently. That is because of the stigma present in the society. And among many persons, mostly the female counterpart, so amongst them, they have one common idea that if one suffers from RTI, then they should not sit together. Even same soap should not be used, and they should not interdine. So many stigma they have. And utterance of that disease is also found to be, means they actually consider not to utter this disease. An example, that is leukorrhea problem. And in case of leukorrhea, that is white discharge problem. And when women actually suffers from this problem, if they goes for medical treatment, they can either mitigate the problem or they can reduce the infection. But if there is lack of awareness and they suffer it for prolonged time period, so it is obvious that it takes time to cure, and the problems related with leukorrhea that becomes more. And along with leukorrhea, one may face burning sensation during urination, then faint also sometimes. So many things they actually suffer, but if time is more, that means the sufferers symptoms are also found to be more. Then misconception regarding HIV. And HIV, we have heard about HIV, but we actually have many misconceptions regarding HIV. That means we should not utter this name of deadly disease. And many persons they have the idea that having multiple sex partners, because of it one has HIV. And that's why when someone suffers from HIV, family of that person also suffers. And along with that sexually transmitted problem, this HIV, many conditions are associated with it, but mostly people hear about that multiple sex partner only. That's why when one suffers directly, one has means one tries to avoid that person as well as family. So the person as well as family, they suffers mentally apart from suffering from the main problem. Childbirth, it is also one of the important issues related with reproductive health. And place of delivery, it is considered highly important. And nowadays, medical delivery, hospital delivery, it is seem to be common because government has provided lots of benefits if delivery is at government hospital. But nowadays, there is a section who wants home delivery. And even there is also incidents that after home delivery, for getting government benefits that is given to the mother as well as newborn baby, they go to medical to show that it is delivered at government hospital. So in case of home delivery, who is the midwife? It matters. And in many areas, many rural interior villages, one dhai, traditional dhai is found. One aged lady, and she acts the work. So sometimes it is village quack also. And if it is by the aged lady as well as village quack, whether they are using any sterilized material to cut the navel cord or not, this is also an important issue. If one cuts the umbilical cord with unsterilized material like blade, so it creates problem to the mother as well as the newborn baby. And somewhere it is found that one sharp bamboo strip is also used to cut the navel cord. And there is belief, and belief is that if they cut the navel cord with the help of one sharp bamboo strip, the baby will be sturdy and tall. So that concept many people have. And one more thing, that means disposal of the afterbirth material. If delivery is at government hospital, then no issue. But if it is at home, then they actually dispose the afterbirth material, sometime at a long distance or sometime in the under the bed. And they dig out one deep pit and it is disposed. And belief is that if the pit is deep, then there will be longer gap in the next pregnancy. So, and again, it is disposed at a long distance from the place. That is also for the belief of having longer gap to the next child. But how much this belief is scientific, that is also one question. And then antenatal and postnatal care. And antenatal care, that means when baby is in mother's womb, and postnatal care, that is after delivery. So whether the women, they are vaccinated at proper interval, that is prescribed by the medical personnel or not, that is also important, because it is observed that when there is more than one baby in the first pregnancy, because of excitement, they may follow all the immunization process properly. But again, in the next pregnancy, they may not. And in case of postnatal care also, same thing. The mother, she is taking care of their babies properly or not, in terms of vaccination as well as other supports that is required for one newborn baby. That is also important. And along with this, breastfeeding concept is also there, duration of breastfeeding. And duration of breastfeeding, whether it is optimum or not, this is also important. And usually it is said that medical personnel, they say that it is proper breastfeeding should be for at least 6 months, and after that they have to continue it for minimum 2 years. If necessary, foods are provided along with the breast milk. And it is again observed that immediate pregnancy, it is also found. And because of immediate pregnancy, weaning is done shortly. So if weaning is done shortly, then the baby suffers. And again, it is said that when breastfeeding is longer, then the next pregnancy, it is also longer. It is one statistical suggestion only. It is statistical findings that one should breastfeed for a longer period of time. And so along with this, birth spacing is also associated, because if there is immediate pregnancy, the mother also suffers apart from the baby. The baby won't get proper nutritious food from the mother's body. That is also one. And the mother physically, she suffers. And WHO, World Health Organization, they suggested that birth to birth interval, that is for 33 months. That means birth to pregnancy, it should be 24 months, that is 2 years. Along with this, this nine 9 month is linked, that we all know that the baby is in mother's womb for 9 months. So altogether it is 33 months. So if there is birth spacing before 33 months, that is also not good sign for the mother as well as for the baby, because the mother is not physically well enough to take care of the next baby, as well as physical health of the mother, it also matters. So short birth interval, it is observed in India as a whole also. If we say National Health Survey report also, then also we observe that around 50% of birth, it is short. It is short birth interval. It is at short birth interval. So it is also linked with birth spacing. And apart from this, multiple birth is also there. If there is multiple birth nowadays, although it is said that it should be either one baby or two babies, but still in extremely rural areas, commonly they have more than two babies, and in urban area also, it is means incidence is not common, still it is observed. So if it is multiple birth, then also it is not good for the health of the mother as well as for the baby. Next, it is the menopause. Menopause is the cessation of the reproductive period. That means the periodical cycle, it is stopped. And according to WHO, it can be confirmed as menopause when there is 12 months of amenorrhea condition. And as in menopause, it is the transition phase from reproductive to non-reproductive stage. That's why it introduces a woman to a new phase of life. And AZ menarche and AZ menopause, both are interrelated. The time gap between AZ menarche and AZ menopause, it is known as reproductive span. And if one experience menarche at early age and experience menopause at later age, that means reproductive span is longer. And in this case also, social issues are related, and education is also related with it. Aged marriage is also related with it. If education is less and aged menarche is early, then people have the tendency to get married early. And from earlier studies, and that is also statistical findings, that if the first baby is before 19 years of age, and it is not biologically good for the mother as well as for the baby. So this is also one. And secondly, if reproductive span is longer, then the female, they get more time to deliver a child. And along with it, education is also related. If someone is educated, they actually know the timing of marriage, and so and then know the use of various contraceptive uses also. So problem is less in this case. But if one experience menarche early, then education is also less, then get longer reproductive time, then there is chance of having more number of babies. So this is also one issue. And along with it, it is said menopause is also related. And whatever it is, as a whole, menopause, it is divided into three categories. And first one is post-menopausal. So when there is no menstrual bleeding for previous 12 months, it is the time frame that is known as post-menopause. Then if one experience irregular bleeding, and also there is no menstruation for previous 2 months, it is perimenopause. And then if there is minor changes in cycle, then it is premenopause. And when we see thing globally, menopausal is globally, then it is said that 45 to 55 years, it is the time frame for menopause. So exceptional cases also observed. And in case of Indian scenario, it is 45 to 50 years. And apart from this, after 40 years also, below 45, as well as just after 30 years also, this is rare still, it is found. So one experience post-menopause. And menopause, no doubt it is a biological issue, and along with it, social issue is also there. Social issue, that means proper dietary habit, then use of smoking, and then high BMI. So many things are associated with it, and sometimes it is spontaneous. And if menopause is not natural, then one has to keep importance on it, because after menopause, lots of things in one's life is changed. So as many things are changed with menopause, then one woman suffers. And sometimes it is observed that some women, they actually feel free after menopause, because there is no burden of childbirth, there is no burden of imposing any rituals that is associated with rules and regularities, that is associated with the social rules, that is with menopause. That is one. So if one feels free, then problem is relatively less. But if one takes seriously, that is a negative way, then it creates problem to the life of women. And it is obvious that after menopause, a woman experience many symptoms. Symptoms like hot flashes, extreme tiredness, forgetfulness, depression, bone issue, then sleeplessness. So then blood pressure is also associated with it. Night sweats, loss of sexual desire, frequency of increased urine, then urine leakage during laugh and cough. So many symptoms are faced. And when the woman considers it as means freely, then no depression, no means regret, then she is found okay. But many women, they actually have negative attitude towards it, and that negative attitude creates problem not only to the life of the woman but also to the husband as well as for the family. And if one experience menopause, no doubt it cannot be reversed back, but one can try to reduce the symptoms. So I have already said about many symptoms. So frequency of symptoms also, it also matters, because someone may face lots of symptoms, someone may only one or two. So this is also one. And for that, if someone experience menopause early also, and even at right age also, but she should have to go for medical checkup. And attitude like women actually, some women, they feel that there is nothing to expect after experiencing menopause, and she looks ugly also, and husband has no importance on her. So that kind of attitude one has actually. So it is hormonal imbalance. So someone may someone actually does not disturb her husband intentionally, but as hormonal imbalances is there, that's why there is means expression. There is expression in front of the husband also, as well as the family members also. And so as a whole, different issues I have shared, discussed based on my limited knowledge. And from that, I can say some points that proper health education, it is required, and mostly the female maternal education is important. Then healthcare facilities, and nowadays no doubt institutions, primary healthcare centers are available in many ways, but lack of counselor is also important, because in every healthcare center, female counselor is not found. So when female counselor is not found, obviously female counterparts, they will have means hesitation to share their problem to one male medical personnel. They actually feel shy to share. This is also one. And even the number of medical practitioners in the healthcare center, and number of number of the equipments, proper equipments that are required for treating the people, that is also important. Then training programs on sex education, that means if some training programs either on monthly basis, or six monthly basis, or like this, if some programs are organized by the policy makers, so then about the sex education, then people will be more aware about it, because awareness is mostly important. Along with it, biology is related. Then proper nutrition and dietary practices is also related. So if it is if food it is inadequate, then also it is not good. And if it is excess, then also it is not good. And if it is not timely basis, then it is also not good. So what kind of calories, protein one intakes, that also matters. Then because of drastic hormonal changes, already I have said that the many women they suffer. So in this case, actually there is quarrel between husband and wife in many times, because the female actually they feel different things, that she's not getting support from the husband. Whatever she's saying, the husband gives opposite reaction. She feels actually, as well as support from the family members is also important. And that counseling is also important. If one suffers problem, if it is try to keep secretly only among the family members, sometimes it is possible to cure, but if sometimes it is not possible to cure. So if one goes to discuss with the counselor, then at least they will get the proper advice from the counselor. So thank you. And I have shared as per my limited knowledge. And if you have any queries, you can ask. And if any suggestion you would like to give me, you are highly solicited. Thank you.
Thank you so much, madam, for the wonderful presentation. Now I request all dear participants, if you have any query, please come ahead, discuss with Honorable Juri ma'am. You are welcome.
Good evening, Juri ma'am.
So,
Good
yes,
evening,
ma'am.
madam.
I have one query.
Yes.
During the menopausal period, expected duration, can you brief out? Maybe that will be, yeah. How long it will be like? So much issues will be there during menopausal time.
Yes, madam. Yes, madam.
Yeah, it starts with maybe the breaking monthly menstrual cycle, or maybe the disturbance in the pattern of flow and all. So what can be the maybe duration? Maybe it can extend to maybe years, or how long it will be there like?
Yeah. Actually, the symptoms linked with menopause, it is equated with aging process. Common people they equate actually, and statistically it is found that if that time period it is longer from the menopause, if it is suppose one lady experiences menopause at 50 years of age and now she is 65 years of age, and one is suppose experience menopause at 50 years and her age is only 52, then in the later age they suffers many problems, and that problems actually with that problem the lady can adjust because it is linked with aging process. In case of aging also, just after means senescence, it is along with senescence aging process is also found. So gradually she tries, but it remains, the problem remains. Suppose forgetfulness, if we ask one lady if she is younger, then her problem is relatively less, but if it is aged, her problem is more. So but again it is found that one study that is international studies on women's health across the nation, they formulated one questionnaire, and accordingly they have classified the stages into two categories. One is before 5 years and after 5 years. So from different studies, it is observed that during 5 years, there are different problems, and after 5 years, there are different problems apart from some common problems in both the cases. For example, night sweat, hot flush. So these are some problems that is mostly suffered just after experiencing menopause. But in case of later age of life, that problem is relatively less, but sometimes one may face, but it is relatively less. But again, that forgetfulness, that leakage of urine during cough and laugh, that is common in the later phase of life. So that's like, madam. So I am sharing these examples with the various researches already done by different scholars, and from that only I am sharing, but I am not medical person.
Thank you so much.
Thank you, madam.
You're welcome, sir. Thank you so much.
Again, I request if you have any query, please come ahead or we move forward. So thank you so much, Radha ma'am, for your queries, and Juri ma'am answered it.
Thank you, sir.
Now I request the chief organizer. Yes, ma'am. I request the chief organizer of the series, Honorable Principal Ambedkar, sir. Sir, please come up and have some words for today's session. Please, sir.
Juri madam and Mr. of her Juri madam, Dr. Devajyoti Borah. Also those who are relatives or invited from your side, all the participants. I think this is second couple which is delivering the talk in this webinar series, and all the participants, those who are joined from various field of the country. I am on screen seeing Dr. C.B. Ausa sir, my college friends, K.N. Kadam sir, Jamuntrao Kadam sir, Dhole madam, IQC coordinator Dr. Sanjay Kale sir, and all those who have participants joined here. As we are aware that this world record webinar series covers all the topics related to our health, education, technology, law. So this type also covers the important information for the female participants, also to all, because this information, scientific information, is compulsory to know everyone for a good health of women, those are at our home. So not being a medical practitioner but as a research scholar, you contributed here so much important things related to the women health and reproductive health. What are the beliefs of that particular points also you have noted here. So it was a new thing for us. Thank you madam for joining here as a resource person. In future also we will invite to you to join as a resource person on the topic as per your convenience. Thank you madam. Thank you.
Thank you, sir.
It was best speech, also best PPT, and particularly compiled all information related to this topic by you. Thank you. Thank you.
Thank you so much, sir. Now I move towards the vote of thanks. Shri Kumarswami, Mahavidyalaya, Ausa, District Latur in Maharashtra State. It's organized a world record series too. Today we have completed 273rd day of the series. And the topic for today's session was that reproductive health which have been presented by Honorable Dr. Juri Madam, where Madam have explained that what is the meaning of reproductive health, then why the reproductive health is important, then different components regarding the reproductive health, and also reproductive health problems and how to be treat medically. Now all these points you covered in your lecture, madam, so nicely, clearly, in a simple words. We could get more knowledge from your side, from your lecture. So thank you, sincerely thanks to be present here in the session on behalf of the organizing committee members. Then I thanks to the chief organizer of the series, Honorable Principal Ambedkar sir. Also thanks faculty members of my college, IQAC coordinator Dr. Sanjay Kale sir, Praveen Kamble sir, Honorable Praveen Udge sir, and Dr. K. N. Kadam sir, and all others. Thanks to Radha ma'am who discussed in the session, asked nice query. So thanks a lot to you, and heartily thanks all those dear participants who joins regularly to the series. Now I request you all please fill the feedback link which is given in the chat box. With the kind permission of the chief organizer, I declare today's session is over. On screen, special thanks Dr. Oza sir, my dear friend Sonu Kumar sir, Chetna Arora ma'am, and all dear sweet participants. Thanks to you all once again. Now please fill the feedback link. Thank you so much.
Thank you, madam.
Thanks a lot once again, Juri madam, for the informative knowledge to us.
Thank you, sir.
Yes.
Thank you, madam. I forgot to name Radha madam and our Javir Singh sir and all the participants because I have not mentioned your name. Javir Singh ji, thank you. Thank you, Oza sir. Kindly keep joining and share this same link every day 8 p.m. No new link for all to your friends or your contacts. Everyone is requested to share the link to all the your contact because every day same link. Just keep time 8 p.m. in your mind and join with the same link every day. Thank you. Thank you.